What if you didn't wait until you were sick to see your doctor? What if your visits were about staying well instead of getting well? Today, we're talking with someone who believes that prevention and empowerment can change lives. Let's get connected. Each week, we talk with the amazing providers and team members who are powering communities through caring connections across Arkansas. Today, we're heading to our Little Rock Midtown clinic to meet someone who believes health starts with knowledge and empowerment. Dr. Gina Tilley. Dr. Tilley is board certified in family medicine and has been practicing for 20 years. She's part of the Healthy Connections team in Little Rock, and she brings a passion for preventive medicine, wellness, and helping patients take control of their health.
Dr. Tilley, you've been practicing medicine for 2 decades, but I know your story starts in a totally different place, New York City. Tell us a little about your journey and what brought you to Arkansas.
I guess love brought me to the South, but I liked it so much I stayed. So I did go to medical school in the South, and I guess the rest is history. I found myself in Little Rock, and I've been here for over 20 years, and I love it.
That's such a great story. So tell me, was medicine always your calling, or did something in your life spark that passion?
Yes, it's definitely something that I wanted to do for many, many years. It's been an aspiration, so I feel very fortunate and blessed that I get to practice medicine.
And now that you're at our Midtown clinic, what kinds of patients will you be seeing there?
Well, anything and everything. Primary care. I'm a big believer in preventive medicine, which I feel is very important. I want my patients to know that they're in control and empowered, and I'm there to help them along their healthcare journey, with the decisions that they make on a daily basis and how it affects their health and their lifestyle is so important to me.
I love that. You're really talking about a proactive approach instead of a reactive one. Do you feel like people tend to wait until something is wrong before seeing their provider?
I think people usually think, I'll go to the doctor when I'm sick, but I think you need to go to the doctor when you're well so that you can stay ahead and stay on top of a lot of issues that can be prevented, even detected early. Knowledge is power. In that sense.
We'll take a short break and be back with more Connected. There's a moment when everything changes, when you stop wondering, what if, and start saying, what's next? That's your turning point, the choice to take control of your health and your story. At Healthy Connections, we're here for you, to listen, to guide, and help you take the next step. This is the turning point. Check, protect, respect. Start today at Healthy Connections. Welcome back to Connected. We're visiting with Dr. Gina Tilley of the Little Rock Midtown Clinic.
One of the things that really stands out about your work is that you also see patients for things like HIV care, PrEP, and addiction treatment.
The MAT program is very important, with unfortunately, the growing issue with opiates and addiction, that's something that definitely needs to be addressed that is not addressed, I think, often enough or, on a wide enough basis. So that is something that I'll be treating as well as HIV patients. For them, the same thing, coming in for regular visits is so important, checking their labs. Because now HIV is not a death sentence like it used to be. It's a chronic illness, really, or chronic condition, I should say, that can be managed just like hypertension and diabetes.
That's such an important message. You mentioned how much you value the Healthy Connections mission, our 3 pillars of community, compassion, and excellence. How do those ideas connect to your own philosophy of care?
Healthy Connections goals align with my own as well. The patient needs to be kind of treated as a whole. and know that we're a large part of the community and that we're here, for them on an ongoing basis, long term.
Why are those services so important to offer in a community clinic setting?
We're here, we're very flexible, our hours, and open to walk-ins, which is very important. A lot of clinics do not have that option, and we do. And I feel like we make every effort to have our patients seen the same day.
I couldn't agree more. Now, when you finally clock out for the day, how do you recharge? What keeps you balanced outside the clinic?
Probably spending time with my family is the most important thing. I definitely like to practice what I preach and try and get a good workout in. So exercise is very important to me as it's part of lifestyle, modifications. And I like to discuss with my patients, not just diet and nutrition, which are very important. And I like to study nutrition when I'm not in the clinic, believe it or not. But probably spending time with my family, exercise, definitely spending time outdoors.
I can tell wellness isn't just something you talk about, it's something you live. Before we wrap up, is there one thing you want every patient to know about their own power to stay healthy?
I feel like people in general don't realize how much in control they actually are of their health. I think they believe, I'll come to the doctor, I'll get on these prescriptions and, they can fix it. When actually, I really truly believe that my patients have that power and that control by the decisions that they make on a daily basis with their lifestyle. Nutrition, exercise, all of that, is very important, and it's all in their control. And I feel like I'm there to kind of guide them and support them through that, and to have them really realize that they have more control than they believe.
That's such a great reminder. Dr. Tilley, thank you so much for joining us today and for everything you're bringing to Healthy Connections in Little Rock, Midtown.
If you'd like to schedule an appointment with Dr. Gina Tilley or learn more about Healthy Connections, visit healthy-connections.org or call 888-710-8220. Thanks for tuning in to Connected. New episodes drop every Tuesday, and you can find them on Spotify, YouTube podcasts, Facebook Reels, and the Healthy Connections website. And since it's Halloween week, have fun, be safe, and remember to check those trick-or-treat bags before you dig in. From all of us at Healthy Connections, happy Halloween.